this question is just pregnant with meaning. Tim Gabbett said, it's not the load that breaks you down, it's the load you're not prepared for. So if we treat people like snowflakes, then we're not preparing them. And it's very easy to feel like you're doing the right thing by being empathetic and being the supportive person who's rubbing here and not poking the bear. But if we don't find people's edge, then they are not prepared for uncertain futures. And we cannot predict the future. So, if 90-year-olds benefit from progressive resistance training, why are we taking 20, 30, and 40-year-olds and managing them away from load? So the third principle is about resilience and robustness. And after we've given people a positive experience with movement, which is reactivation, then we want to progress them to the hardest thing they feel safe doing. So always should feel safe, but there has to be a ratio of challenge to threat. And at first, challenge and threat are very high. But if we take all threat away and also take challenge away, then we're not going to create resilience. So we want to bring challenge up and keep threat down. The role of a great rehab person is that they can increase challenge without increasing threat. They can create a gap there. And that's the opportunity. I want us to reframe the problem. We have to ask different questions. In the clinic or gym, just by having a different environment, by not having a bunch of treatment tables and soft, soothing music going, by having older adults lifting kettlebells, you change the environment. Now there's no longer the tyranny of the clinic, and people's expectations begin to change. And now what we create is the opportunity for education. So as Mosley says, education isn't something you do. Education is something that happens. I want to gamify that.